Action.
Snug, providing privacy. Hi there, I'm your nurse, Hannah, and I've just come from the med room and checked all my drugs here and brought them into the room. Can you tell me your name and your date of birth?
It's effervescent.
Great, and do you have any allergies? Alright, that's what I have in my mark. Perfect, you're the right patient. So for you today I have some topical drugs. I have eye drops and ear drops, but we're going to start right now with the topical stuff. Wash my hands. Front gloves.
Discard any extra that remains. Once I open the bottle, I'll wipe the paper towel.
Okay. So, if I have something that I have to put, just like an ointment or a cream, maybe there's a rash, I'm going to look at the affected area and evaluate the skin, clean it off as needed, and then according to my prescription, I would take a small amount once that's dry, and I would put it into my hands, and then I would just rub that in there, just a thin layer. And depending on what that drug was, I would explain it to the patient. Maybe it's a steroid to treat contact dermatitis, something like that, and let the patient know. And just keep an eye on that over time, make sure there's no irritation. If I had a patch, I would be looking for the old patch. Say it's a fentanyl patch for pain. I would explain to the patient that it's to help relieve pain over time. It's a long-acting drug. I would make sure that it's correct in the MAR, and then I would find the old patch, take it off, and then I'd fold it in half and put it in the sharps. Inspect the skin and rotate sites, and then I'm going to clean that area off. So that's where we're going, or maybe the shoulder. Depending on the drug, it's going to be on a different place. I want to make sure there's no hair kind of in the way, and I'm going to instruct my patient not to shave in the spot as well. So I would open up my patch, and then I would have written on it the date, the time, and my initials. And then I'm going to place the patch and just hold it there until it adheres nicely. And then if I had a nitro paste, which would be for angina, I would have a prescription that would have a piece of paper, and the paper would have a measurement in inches, and then I would have a prescription from the doctor, and it would tell me how much I need. And so on that line, I would kind of draw out the amount of ointment that I need, the paste, and then you're going to put that on the chest. So same thing, you're going to clean the chest, explain to the patient that this is going to help treat chest pain. And I would have my initials, date, time, and you put that paper down, and then you're just going to tape it on. So that's it for your topicals. And then I'm going to move on to your eye drops. So with eye drops, you might be treating dry eye, or you might be treating an infection. I'm going to have my patient sit all the way up, have him tilt his head back as far as he can, explain what it's for. So for this, we're just going to say he has an eye infection in his left eye. So what I want is give him this tissue, so when I give the eye drop, if anything runs down, he can blot it. We're going to have it tilt all the way back, and I want to instruct my patient not to touch the tip of the dropper to his eye. We want to keep it away from that, so you're going to keep it at least half an inch above. So with my dominant hand, push down the forehead, then pull back the eyelid, and so on the conjunctiva, keep this half an inch up, and we're going to say the prescription said 1 drop, so I put 1 drop there. Keep your head tilted back, and you can blot that. Perfect. And if you were doing 2 eyes, then you really want to make sure you're not contaminating. Yeah, and if it were a systemic drug, then what you want to do is when you give the drop, then immediately after, you want to touch the lacrimal sac there and just hold on to it for a few minutes, about 3 to 5 minutes. Make sure that it's staying in the eye and not going anywhere into the body where it can affect blood pressure or anything else that we don't want it to. And then we're going to go on to eardrops. So this can be, sorry, we're gonna do, wait a minute. So, which is very similar to the eye drops. So you have the head back again, and you have the lower lid pulled down, and you're just gonna do a thin line inside the eye without touching the dropper. And you're gonna go from the inside to the outside of the eye, keeping it a few centimeters above. And that's gonna close the eye, and it's gonna be a little blurry, so make sure my patient knows that that's gonna happen, not freak him out, he can't see. And it's gonna be blurry for 2 to 3 minutes, keep your head back and eyes closed for a little bit. Okay, and then we're gonna move on to the eardrops. So I'm just gonna get my patient into the side lying position because he's gonna have to stay on one side for 5 to 10 minutes. That's a long time to bend your neck, so we're gonna have him laying on his side. But that will be simulated because he doesn't have good side lying strength as a mannequin. So we're just going to say it's going to go into his left ear. We're going to tell him that it's for an ear infection. I'm going to clean the outer ear as indicated, and then you're going to look at your prescription, say you need 1 drop. Okay, so clean the ear. You pull back the pinna and keep the dropper like 1 to 2 centimeters above the ear. So 1 drop like this. Oh shit. Yeah, okay. So do that, and then instruct the patient to stay in that position for 5 to 10 minutes. And you're going to put the cotton ball in there to make sure that the med is staying and not leaking onto the skin where it can cause some irritation. Then I'm going to, once that's all done, make sure my patient is comfortable. Take off my gloves and discard them. Perform hand hygiene and document in the MAR.